Hello. Thank you for joining us today on Matters of Substance. This is Carley. I am your host. And also I have our co-host here, Betsy. Hello, Betsy.
Hello, Carley, and everybody out there.
Thank you for listening to us again today and joining us. So Betsy and I are kind of doing something a little different today. Instead of having a very special guest, we are your guests and your hosts. So we're going to talk a little bit about some things that we know and have learned over time as preventionists. Something that we've recently been trained on is Overdose Lifelines. This is not about drugs. I have been a presenter for that program for several years, and we redid our certification, and we just learned some kind of new things, some updated things to that curriculum that was shocking. And so as we were kind of debriefing that training, we thought, you know what, we need to do an episode about opioids. We need to talk about that. What's that look like? What's going on? We've learned that over the last couple of years, there's been some higher trends that we'll talk about in a little while. And so I just wanted to, we wanted to just share with you guys, our listeners, what is going on and what we've learned and just where we're kind of at in the state of the opioid epidemic.
Yeah, I feel like there was, pretty good concentration towards opioids there for a while, and we saw that in the numbers. I mean, if you look at those age rate or those dates, the numbers were trending in the right direction. But I feel lately, that's gone kind of quiet, how much attention we've been paying towards opioids, and you can see that in the numbers that there has been a drastic increase here lately, especially in our state and surrounding states. So I think that's something that we need to shed a light on so everyone's aware.
Yeah, for sure. If I remember correctly, we learned through Overdose Lifeline that in 2018 or 19, we were sitting at about 70,000 overdose deaths a year. Mm. And we now have reached in the last year, I think it was 2022 was the stat they gave us, 106,000 deaths in a year. Mm-hmm. 70,000 is a hard number to hear because that's 70,000 people in the United States that die from overdose deaths. But then to add another 36,000 on top of that was almost heartbreaking. In a matter of 3 years, I believe what the time span was.
Yeah, they said that they kind of gapped it. So starting from 1999 to 2020, they said that was when they kind of looked at this as a health crisis. And in that time period, I know that there was 933,000 people that have died. And especially in young people, it is the leading cause of death is overdoses. Beyond car accidents, or any other things, it's overdoses.
Isn't that so scary?
Yeah, it really is, especially, I'm a parent, you're a parent. That's terrifying, those numbers. And I think that's why it's really important that, we try to teach our parents is that you got to have those conversations. I know it's hard sometimes. I know it's uncomfortable. But having those conversations is so important and doing it over and over and over again. And then also, too, we're seeing a lot of trends where youth are be able to buy opioids and other medications through social platforms. And we have some handouts here that has certain lingo or emojis that kids can use to do that. But it is becoming pretty commonplace that kids are able to do that over the internet. And not just opioids, but all sorts of other medications, drugs, marijuana. They're able to get that through those social platforms. So I think that's why it's really important that parents stay informed and then have those conversations with their kids.
Absolutely. I believe I read that social media is like the leading way for these specifically counterfeit pills that have been created by people. It is the leading way that youth are being marketed to and sold to. As preventionists, we have like data and information and handouts on all of that. So if you're listening and you're like, I want to know what some of the lingo might be that my teen might be using or my youth might be using. Or I want to know maybe what some emojis might mean that kind of indicate substance use or substance purchasing. You can reach out to us, and we are happy to provide you those resources as a parent or just a concerned community member. So yeah, let us know. You can reach us at our website, which would be hubcoalitionpc.org. If you're listening to this, we are currently under construction on that website, but we are hopeful that we'll have it up before this episode airs. So just be kind of aware that you might run into that. So you can reach it there, or you can just give us a call, 219-280-5252. We do service Porter County, Indiana. And if you are somewhere outside of Porter County, Indiana, you could probably reach out to your local coordinating coalition or a drug-free communities coalition. Any of those kinds of coalitions in your community would have these resources.
Also, I also like to steer people towards the health department. Their local health departments, they always have great statistics. National Institute of Health, there's SAMHSA, which is SAMHSA. They are a really good resource. And CADCA, CADCA. Those are all really good resources that have pretty solid data. And I know that SAMHSA has a great program called Talk, They Hear You, which really helps parents navigate having those conversations with their kids, having exit plans. I know it's something that I've talked about with my kids. If you are in a situation where stuff's going on or you're uncomfortable, they will just text me a certain picture, or we have like a code word, or they just call me and I'll make up an excuse like, I'm the bad guy, I need to come get you. So it puts it on me, not them. But we have those conversations, and there's been times where we've had to use them, and that's great. Like, I'm glad that they're utilizing these skills, but a lot of parents don't even know where to start, which I don't blame them. I mean, I work in prevention, so I know. So, that's the whole point of this, is we want to be able to help everyone out there, navigate this serious issue.
Mm-hmm. Absolutely. And, that goes for caregivers, parents, grandparents. Even if you aren't a caregiver, if you're just a loving adult in a youth's life, then this podcast, this episode is for you to listen to. Listen to the skills, because you can utilize those as well. So one thing I would like our listeners to kind of have a base of before we delve too deep into the topic of opioids is what opioids are and how they kind of impact the body. I know that opioids have three kinds of classifications, if you will, is how we look at it. You have your natural opioid, you have your semi-synthetic, and then you have your completely synthetic, which is man-made. So when we're talking natural, we're talking like the opioid, the poppy seed, that's what we talk when we say natural. It occurs in the wild. When we talk about semi-synthetic, that can include things like Percocet. It can include things like heroin. And then when we talk about fully synthetic, we're talking about things like heroin. We're talking about things like fentanyl. Mm-hmm. And so we also can, of course, give you more information on that if you're ever interested. But you can check out Overdose Lifeline. They have a lot of information about opioids, and This Is Not About Drugs, their teen program. They have a page where you can learn a little bit about what that program looks like, and it gives you facts and things like that. So, Betsy, you being a licensed healthcare professional, I thought it would be helpful if you explained a little bit about like the brain science behind how an opioid impacts a person.
Mm-hmm. So when you are ingesting opioids, you are basically, flooding your system with dopamine, which dopamine is your feel good. It drives motivation. And it also drives, seeking behaviors after a certain time. So when you flood your system with this feel-good dopamine, your body stops making its own dopamine. And that is why you start building up that tolerance. So you had that good feeling when you took one, but then that doesn't work. And so all of a sudden, then you need to take two, and then you need to take three, and then you need to take 4 to keep that same feeling, because your body is still decreasing their own dopamine production. But then also it's building up a tolerance. That's just naturally happens. And that's what happens when you start overdosing, because you're having to take so much more and it's not being as effective as it was. And that's why I always tell people too that when you stop using that medication, it can be very, very, very painful, because your body doesn't automatically just start making this dopamine that you are lacking. I kind of attribute it to when I would teach youth classes, the Bee Movie. You know, they were making honey, and then all of a sudden, you know, they had to stop because there was so much honey they were getting, because they seized it all from the people that were taking it from them. And so they stopped. But then they run out of honey, but they haven't been told to come back to work. So your body, it takes time to build that up. And that's where you get like the pain and everything. Also, because you don't have dopamine, you get severe depression issues. You get, you know, motivation. You don't want to get out of bed. You almost have cold-like symptoms. So it's really, 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 really hard to quit opioids. And then on top of that, these neural pathways start connecting in different places, and your body really starts to, with your brain, not being able to tell the difference between the drug and its need for basic necessities. So your body looks at that drug and it categorizes it the same as water. Like, I need this to survive. And so that's a really hard thing to combat when you're trying to stop using a substance. Imagine your brain telling you, like, no, I need this to survive, and then having to overcome that. It's a very hard thing to do. And it can take months, years. You'll eventually see the changes in the brain, you know, start to go back in a different direction, but it's really, really, really hard, especially with an adolescent brain. The use of any substance at an early age puts you at higher risk for using stronger substances or becoming addicted later in life. It also puts you at higher risk for some mental health issues, along with other health conditions. So I don't think, you know, people realize how much goes into, you know, the changes of just taking opioids.
Yeah. Yeah. I think when we talk about the brain and how it works, one of the reasons that we promote naloxone or Narcan, it's commonly referred to with both names. One is the brand and one is the actual medication. So when we talk about Narcan, what happens is that opioid receptor that gets kind of blocked from, or when the way your brain works is you have these receptors, and the opioid covers that receptor. So when you take Narcan, it throws off like the cap is how we describe it from that receptor. And then that is how you come out of the overdose. So when we talk about opioids, we're talking really about the brain. We're talking about the brain's reaction to a chemical that is ingested. And I think that's important to remember. We often, I think, stigma comes with the territory of people who misuse substances, but what we know to be true is that it's a disease of the brain. And so, you know, part of our job is to help reduce that stigma, help people understand, just like what Betsy explained, how dependence happens. It's not that somebody decided that they wanted to become dependent on heroin. It's that they tried an opioid, whatever opioid, or maybe another substance. They tried a substance, and their brain told them, no, you need this to survive. You know,
and it happens too. There is a genetic component too. If you have a family history of addiction, you are also most likely. And so if you're prescribed opioid medication, let's say you have surgery or, you know, some other ailment where you needed pain medication, there sometimes people I've talked to has described it as they take it and it's almost like for the first time they put a key in and the lock clicked. It was like, oh my goodness. And it's just like that. they start having those cravings and their body says, I need this substance. Plus too, if you have underlying conditions where you're naturally low on dopamine, and then all of a sudden you get this flood of dopamine, your body's going to be like, yeah, I need more of this because I was low on it to begin with. So those are all, contributing factors too, that makes it so hard. So you might not, you could have just gone in for an appointment and prescribed medication, and you weren't expecting to all of a sudden be addicted. Mm-hmm. It's not something like, that you were planning to do. So it happens. Going back to the naloxone too, I think it's also very important to know that if you suspect that there is an overdose happening, administering naloxone is not going to hurt the person if it happens to not be an overdose. So it's always better to be on the safe of caution. Because it's such effective on the brain, the brain controls everything in your body. So you're going to see, slow breaths, lack of oxygen. So you're going to see blue on the lips, blue on the fingertips. The pupils will be very pinpoint. So if you look at somebody's eyes with like your flashlight on your phone or something, they're going to be very small. Heartbeat's going to be slow. Obviously, then you're unresponsive. As we've all been told. So the best thing you can do is to administer that naloxone and call 911. If you haven't had any effects within 2 to 3 minutes, especially with how strong opioids are now, and especially fentanyl, it can take 2 doses. So I always tell people it's so important. I mean, even if you're not planning or an opiate user to carry, naloxone sprays with you, because you never know when you're going to need it. I mean, that's just a matter of fact.
One thing that I find really kind of scary and something to think about is, we know that the DEA says that 6 out of 10 counterfeit pills seized in 2022 contained a potentially lethal dose of fentanyl. Mm-hmm. So what's that mean? When we talk about counterfeit pills, we're talking about somebody who thinks that they bought Adderall, mm-hmm. And really they bought something else. Who knows what that chemical makeup is in that pill. But we know that it's not a hard thing to do any longer to create pills that look like real medications. Mm-hmm. So with that comes some pretty scary, concerning stuff, right? So we know 6 in 10 pills that are counterfeit have a potentially lethal dose. That means we cannot risk it. It is so important to talk to your youth about understanding that if they're at a point when they are considering trying a substance, that they don't know what they're going to get, and it's better to make the choice not to. Going kind of back to that dopamine, how Betsy explained dopamine. Dopamine is the chemical that makes you feel good. Mm-hmm. They call it the feel good mm-hmm. Chemical. Mm-hmm. And so if you are taking something and you trigger that dopamine from that medication, we know that dependence can happen, but we just don't know what that next pill is going to be, or mm-hmm. what that next substance is really chemically made up of. I know in Chesterton, I believe it was last year now because we're in January mm-hmm. 2024. Mm-hmm. Last year, we had some coalition members bring up that there was some person who passed away from an overdose when they thought that they were getting, I don't remember exactly which one, but I think it was a stimulant. Mm-hmm. They thought they were getting a stimulant. They had used stimulants in the past, so it wasn't something that they felt unfamiliar to. And unfortunately, what they received was not what they expected or thought. Mm-hmm. And they passed away from that. And so we just have to be really careful. I don't think as a parent or a loving adult, we just have to know and educate our kids on the fact that, right now, you just don't know. Mm-hmm. And better not to do it and be safe than to do it and either have the risk of addiction or the risk of death. Mm-hmm.
I mean, we're not pharmacists, and the way that they're making these counterfeit pills are pretty spot on a lot of times. And then when they combine it with substances like Adderall, it makes it more potent, which makes it even worse. And I know that there's an issue with medications like stimulants because of the pandemic. There's a shortage. A lot of pharmacies are out, which makes people at high risk for trying to get these pills from other sources. And then stuff like this happens. So yeah, it's just not worth it. You just never know. And they're getting really, really good at making products look like the real thing. So yeah, I would implore people to also just carry Narcan with them. I know it seems like a weird thing, like, well, I'm not using opiates. I don't know anyone that uses opiates. You just never know when you might come into contact with it, or just somebody. I mean, we take CPR classes so we can help people in the public. It's no different than that. You know, in my car, I have my CPR mask, and I always carry a med kit, obviously, because I'm a nurse. But, even before that, I'd always carry that stuff because you never know. Same as planning for a fire. You don't ever plan to have a fire, but you want to prepare in case you do. So that's why we need to carry around naloxone. We need to have these conversations with our kids and give them the best possible chance for a good, healthy outcome.
Yeah, and naloxone, I mean, it's fortunately in Indiana, I can speak for Indiana because that's where we are. It has become so easy to get your hands on it. Mm-hmm. Back a while ago, I don't remember exactly when this law changed, but I know there was a point where you had to have it prescribed. And then legislators, lawmakers recognized that was not probably the best way to do it because it often came with a lot of stigma to ask for that prescription. So now we have it accessible, in so many ways. If you reach out to us, Hub Coalition, Porter County, we will provide that to you. We have a ton of Narcan naloxone boxes out there provided by Overdose Lifeline and restocked by Overdose Lifeline. You can reach out to Overdose Lifeline in Indiana and get a couple doses along with a free training. So there's a lot of opportunity. I think you used to be able to go to some of the local health departments. I don't know if that's true anymore. I think that was a grant that may have ended.
Yeah.
But, wherever you are, that might not, you might be able to. So reach out to your health department. Find out where these, where people are distributing this. Another agency, 320 Recovery in Porter County, they provide it to people for free. So, yeah, it's out there. It's available. It costs nothing, and it might save a life.
Yeah, currently in Porter County, we have a Root Coalition that is implementing all these boxes through Overdose Lifeline. They are currently waiting to install their 18th box here in Porter County, which is awesome.
Amazing.
I think they were just calculating how many doses in the past year that they've installed or given out, and I think it was over 500, which is amazing. So yeah, there's Chesterton, Portage, Valparaiso. There's lots of boxes. In fact, if you again go to our website, we should have a link to once it gets up and running, which I'm very excited about. Side note, to all of the naloxone boxes in the area. If you also go to Overdose Lifeline website, they also have a link where you can see all of the boxes in the area that you in the area that you live in. And you can also take a class to learn how to properly administer Narcan. It's not difficult, but there's certain procedures, putting somebody in the recovery position that is important. And you can take that, and a lot of times after you complete that course, they will send you a couple Narcan to carry around. So I always carry at least 5 in my car. In fact, I have a magnet on my car that says I carry naloxone. And I've actually had a couple of people come out to me and ask me for it, and I'm happy to give it to them. So yeah, it's available a lot more than it used to be. And I hope someday it will be possibly free to just go into a pharmacy. So.
And I think for me, one kind of like an important note is we think of why would I carry it? Who do I know? And as Betsy said, like, you never know, so you should be prepared, which is true. But another element of like people who I think kind of get missed are people who are prescribed opioids. Mm-hmm. It's just a fact. Opioids are also a prescribed medication. Sometimes people get confused about, did I take that medication today? And they just don't remember exactly. And so they might take more than they're supposed to by accident. Mm-hmm. I always in my personal life recommend to anybody I know who is prescribed an opioid medication, I always say, can I bring you some Narcan for you to have on hand? I recommend having it because why not? Just in case. You never know if that day is the day you get confused and you just thought, oh, I took it at noon yesterday, so I need to take it again, and you've got your days confused or whatever, So I would just always recommend having it. Of course, always, but then, if you know people, if someone in your household is somebody who's prescribed an opioid, just keep it on hand. It doesn't hurt to have.
Yeah. I mean, like I said, it's there for help if you need it. If you don't, great. I know that I've had conversations. So, once upon a time, I worked, with hospice and, older populations, and something that they always didn't know is that as you get older, some of these substances like pain medication, you don't need as much. Your metabolism slows down, so you're not burning it off as much. And so they think, I usually take this much, so I can take that much, but that might not be true. And then they get themselves into trouble. Mm-hmm. So circumstances like that is where you need to have that on hand. Again, somebody even that's on regular medication and they have it on a thing, you just never know. Mm-hmm. Just never know. Mm-hmm. So it's always good to have it on hand.
Someone who talks about that and has a program here in our community in Porter Stark and maybe Stark County, I'm not sure, but I know at least Porter County, is Angela Wayner. You probably, if you're a longtime listener, she's been on a couple times. I think she might be actually airing on the radio this week on WVLP, which will be past by the time you hear this. But she should be, her episode should be on our Spotify. But I just want to give a shout out to Angela with Porter Stark Services because she conducts a WISE program. And in that WISE program, it's targeted towards older adults, but they kind of bring that age limit down. I think you only have to be like 50 or 55, which, isn't necessarily what we consider a senior. But older adults is what the grant works towards that she has. And so the program will teach you about the changes that happen in your body as you age and things you might want to talk to your doctor about. Like, I remember when she was on not like a couple of years ago, one of the things we talked about is alcohol. Mm-hmm. Alcohol, the older adult, the way that it processes in their body is different than how it processes in their body when they're 30, when they're 40, when they're 20. Mm-hmm. And so they might have what they consider one drink, but that's actually multiplied by, it's not, it doesn't work in your body as one drink. And so it's just important to know and to educate yourself on your own health as you are at in any stage of your life. As teens, you should know consuming an opioid or consuming a substance makes you more likely to have a dependence later in life. Mm-hmm. As somebody in their 20s, 30s, you should know how your medications are going to affect you. And the same as you age, you should update your information and learn about how your body changes. Mm-hmm. So contact Angela at Porter Stark Services for that WISE program if you're interested. I believe on their website you can find it under the Life on Purpose tab if you're like, I think I should go to her class. It's free. You get some goodies. You get some knowledge. It's a win-win.
It's an amazing program. And she's an amazing person, so it's good fit.
Yeah,
we love Angela around here.
Yeah, I just had to shout that one out because I feel like that's a good connection to what we just discussed. So we've talked a little bit about where people can find resources. One thing I wanted to share that I think oftentimes kind of gets overlooked is what misuse is. Mm-hmm. So I think oftentimes we think of substance misuse as just using illicit drugs. And in reality, the way that misuse is defined or considered is any kind of use of the substance that isn't prescribed by your doctor. So, for instance, if I was prescribed an opioid and I was only allowed to take one pill every 4 hours, if I take 2 pills in 4 hours, that would be considered misuse. If I were to change how I consume that, so delivery method matters. The way that we deliver a substance to our body impacts how our body receives it and impacts how it affects our brain. So if I were to crush that pill and ingest it by snorting it, that would be misuse. Mm-hmm. So it's just important to know that, when we talk about misuse, we're not just saying if you misuse heroin or if you use heroin, that's misuse. No, it's anything that you use that's either illicit or prescribed and taken not as prescribed. Mm-hmm. I don't know. I just always feel like that is important to share.
It is. And I have to say that when I was a kid, I know that we did that in our family. And now I'm just like, oh, no.
Wrong move.
But yeah, I mean, my parents would get prescribed a medication and then something would happen to me and they'd be like, oh, yeah, just take this pill. And now I know better.
Yeah.
So, yeah, I know that happens. And I think that's probably too... kids are exposed to more medications, not only in those instances too, but just with the legalization of marijuana and some of those other substances. Even if it's, medicinal, they're still taking it and it's still being exposed to their system. And again, it puts them at higher rate for addiction later in life. So,
yeah, absolutely. And it's important to know also, I think, one thing that this is a fact that we share when we do This Is Not About Drugs. And I find it so incredibly mind-blowing, I guess. So if you are a teen or an adolescent and you have had your wisdom teeth pulled, that puts you at higher risk for dependence. Mm-hmm. The reason being is that you have likely been prescribed an opioid. So, prescribed or unprescribed, it still puts you at a higher risk. It doesn't mean that you're going to, if you get your wisdom teeth pulled and you're prescribed an opioid, that you're going to necessarily become dependent, but it just puts you at that higher risk because of you having introduced an opioid to your body at that younger age.
Yeah, obviously if you need your wisdom teeth out or you need surgery, obviously you need to have that surgery. But knowing that stuff beforehand, and making sure, one big thing is my daughter had knee surgery. I love my daughter. I trust my daughter, but I still administered her medication. I always knew how many were in the bottle. I kept track of when she took it, whatever. And I always encouraged her to not take it unless she absolutely needed it. I told her, if you need it, of course, I'm going to give it to you. And I think she's always become very responsible. But she doesn't want to take medication unless she absolutely needs it. And I think that's a good attitude to have. Again, if you need to take the medication, you should take the medication. That's absolutely what it's there for.
Can I say, just to add to that?
Yeah.
I think, I kind of point this out because for me, I think this is a conversation you should start with your doctor, right? Mm-hmm. So if you know that maybe you or a friend or your child broke their arm, probably not your friend, you're not going to the doctor. But if you or your child say you break your arm, it's reasonable to have a prescription of a pain reliever. But I think what we do with that is we talk to our doctor and say, what do you think I need to be prescribed? Can you kind of give me the logic behind that? And then have a conversation and decide together if you think that's necessary. And if so, what the method is going to be. When I had a surgery, a minor surgery when I was in my early 20s. And I was prescribed an opioid that I needed for I think a day or two, and I had a week and a half worth, and luckily for me, I was always very responsible with those things. But had I just been it says a week and a half, I'm going a week and a half, that might have been pretty detrimental to me, right?
Right.
So I think it's talking with your doctor about a realistic plan and what a realistic need looks like. And maybe it's, you set it for a refill and I pick it up if I need it kind of situation instead of giving me the whole week and a half. give me a week and then I call in the rest or whatever that looks like. But my point is, I guess, talk to your doctor and make sure that you are both on board with what is the best health plan for you.
Mm-hmm. And have those honest conversations, I've talked to my kids, we have a history of addiction in our family, and my kids are aware of that. So they know they need to be extra cautious. And in nursing school, they always taught us least invasive to invasive. So I'm going to try, things like physical therapy and muscle rub and all this other stuff for injuries before I go to something, bigger. And I think that's just a good attitude to have. And have those conversations with your doctor. Well, is there anything else I can do before I have to take this medication? So.
Mm-hmm. And once again, I love that you pointed on that. Your family history matters because, you might go in and say, well, I don't feel like I have to worry about it. But, did mom and dad, grandma and grandpas, aunts and uncles, do they have dependents? Have they had that history? And if so, that's still something you need to consider when you make choices for yourself.
Yeah, I try to be as informative as I can, with my kids, whether it's, any substances or mental health issues. I want them to know exactly what's going on with their body, why they may need this, because I still think there's a lot of stigma and shame. For example, if you need a medication for depression or anxiety, I think sometimes too, there's still this mindset, well, I don't, this is dumb. I shouldn't need a medication. Well, it's brain chemistry. Sometimes you just need this medication. It's not your fault. Your brain just doesn't make enough, and that's okay. But it also puts you at risk for other things. And just knowing that information can make all the difference in decisions and not, falling into those pitfalls that can happen. And addressing these mental health issues rather than trying to fix it on your own with substances, which can happen, can make the world a difference. One thing when we just took this class, I knew a lot of the stats. Obviously, they had been updated, and I was just really, really surprised. So for 15 to 24-year-olds, per 100,000, the use of or the overdoses were 16.7%. And then in both youth and in adults, the higher rate of male usage is really, really high. So for youth, female is 9.6%, male is 23.5%. I mean, that's a huge difference. And it's even more so in adults. The rate of overdose deaths for female was 17.1 and for male was 39.5. Again, huge difference. And then they go beyond that and break it down into certain demographics again. And I was shocked. So I was born and raised in South Dakota, and we have a large Native American population. And I was surprised at these numbers. Their rate of overdose was 41.9%.
Wow.
I was just flabbergasted.
Yeah.
And then as far as male usage goes, their percentage was 52.1 versus female, which was 32. But both those numbers are extremely high. And from 2019 to 2020, they saw a 40% increase.
Wow.
So that is a huge health disparity that we need to focus on. Mm-hmm. I couldn't believe those numbers. So,
well, you're talking over half, in males and a third in females. Mm-hmm. That's a lot.
So I think that's another factor too that we need to have conversations with our kids. Again, I'm a big proponent is, the more they know, age appropriate, of course, but the more they know, I think the more that they better understand why things happen the way they do and why they need to do the things they do. I mean, when kids are young, why is their favorite word. Why? Why? Well, you're telling them why. And so then they can be like, oh, okay. Yeah, I understand that. I just think it's just a great way to approach it.
Yeah, and I also would agree. I feel like, and I don't know if this is a shift from like my younger generation to now, when I was younger to now, but I feel like youth right now, and maybe it's because of the age of the internet, I'm not sure, but they want to know, they want to understand. I feel like now youth more than ever, they want to understand the why of things, like you said. They want to grasp the concept. And I think that they're great at making good choices once they understand all of the information. So we have to be the people that fill that in for them. We have to educate them. I mean, that's what education is. It's telling people information and having them comprehend it and then put it to practice or use it at future dates and times, right? So that's really what we need to be doing.
Well, I think it helps with the stigma and shame. You know, I know that was a hard thing. So again, before here, I worked in a drug and alcohol treatment facility, and there was such stigma and shame when they were in there. And when I would do some of my classes, educating them on, you know, why your body was going through what it's doing, why some people become addicted, some people don't, whatever. Them knowing that information made the shame less, because a lot of times they were like, oh, well, it's my body's chemistry. And it wasn't like, it is hard to overcome. And so I shouldn't be shamed because I feel like I'm weak. And I think that made a huge difference for people. They're like, okay, I know what's going on with my body. I know what I need to do to get healthier and better, and it's still going to be hard, but at least I understand. And I don't know, it took away some of that shame for them. So, yeah, education is power.
It quite truly is.
It is. It really is.
So we've talked a little bit about opioids in general. We've talked a little bit about a lot of things, really. I think it's important that we dive into some like facts and fiction, if you will. I'll start off. So one of the things that we learned is that, and I'm sure that you've heard this, if you've got any kind of like media outlets that you go to, but there's been a lot of like controversial conversation around marijuana being laced with fentanyl. And we hear frequently, you know, that it can happen, and that, you know, of course, fentanyl could be fatal. And there's a lot of like kind of almost, I would say, scare tactics in that conversation. And one of the things that we've learned kind of through our own research and through research with Overdose Lifeline and education through them is that it is actually false that fentanyl-laced marijuana is causing widespread fatalities. So when people hear that, you know, you can know that that is not true. American Addiction Centers has stated that there is no scientific data that would validate the assumption that fentanyl-laced marijuana is causing widespread death or fatalities. We know that fentanyl burns at a much higher rate than marijuana. So chemically speaking, if somebody is ingesting marijuana through smoking it, it would be burned before it would even impact the person, because it burns at such a higher rate. And we know that smoking cannabis flower involves loading the material into like a pipe or a roll or something like that, and then it gets lit on fire. So that would negate any potential laced fentanyl to current standards knowledge. So, you know, we know things are always shifting and changing. But at this point in time, that is what we're hearing from some really reliable sources like the American Addiction Center. A test, there was a study to determine if that was true or false, and through the U.S. Army Test and Evaluation Command. And that was supported that smoking marijuana, fentanyl would not be, it would burn before consumption.
Obviously, that's not the same for edibles and tinctures and stuff like that, but for the flower burning, yeah.
Exactly. Yep. And it's important to know, regardless of that, and we've talked a lot about marijuana here on this podcast. And we'll probably do another episode coming up, I imagine, because I just think it's such an important topic. But there are still dangers that come with marijuana. It doesn't mean, fentanyl, it's not laced with fentanyl, so it's safe. No, that's not true either. However, that's just kind of a different episode, different topic, because there's a lot that go into like current potencies and all kinds of dynamics going on with marijuana right now that we, of course, will keep you guys updated on. And I'm thinking here probably in the next month, we'll probably be doing another episode on it, if I remember correctly, for our plan.
Yeah, our plan. Another myth that I hear a lot is that you can overdose by just touching fentanyl. You cannot overdose simply by touching powdered fentanyl. It's a common myth. Again, I've heard it a lot. Fentanyl must be introduced into the bloodstream or a mucous membrane for someone to feel the effects. So yeah, I know I'd heard that one a lot. And that's why, EMS workers, they wear gloves and they wear respirators and all this other stuff to protect themselves. But yeah, you cannot just touch and overdose. And then another one, when I was working with the root committee, that they even brought up that they were hearing a lot was that naloxone didn't work on fentanyl. And that's false. Fentanyl is an opioid, so just like the opioid, it will respond to naloxone. Being as it's so strong, sometimes it takes a couple doses, but it is effective.
Mm-hmm. I just got a great idea. I think, guys, listeners, let us know what you think. I think we should put Fact or Fiction up on our Facebook page and have people listen to this episode to find out.
Yeah. No, I think it's good. I hear so many things. And, of course, they can be harmful, because if somebody heard that, naloxone doesn't work on fentanyl, and so they might not administer it. And that would obviously be very detrimental.
Yeah.
And I know there was panic with law enforcement for a long time, because they thought, well, I just touch it and I'm going to, have this lethal dose. Well, no, that's not the case. So dispelling these myths are very, very important. So I would love to hear people, if you go to our Facebook page, maybe share some of the myths you think that you've heard, and we'll see if they're fact or fiction or not too. You can go to the Hub Coalition site on Facebook, and we also have Hub Coalition on Instagram. So you can send us a message.
And look, we love to research here. So
Yes.
if you're like, I don't know, but I want to know, we will make sure that we find out from reliable, valid sources an answer to your question, or tell you if we can't. We will definitely never steer you in the wrong direction.
Yes.
To the best of our ability.
To the best of our ability.
So, so that's just, kind of a little bit of like false, fact and fiction. We thought, I guess, collectively, because we actually both came up with like some false and or facts and fictions, I guess. And we're like, we should talk about this. And we're like, yeah, okay. Well, we both have that on our list. So clearly we need to do it.
That's right. I think that's important. This is important. Because sometimes there's a lot of... I have to always, people will call me and be like, I saw this. Is this true? I'm like, no, it's not true.
And it's so hard, right? Yeah. Because... I don't know. We have so many ways that we gain information now. I guess billboards were always kind of there, but you have billboards. You have your phone if you're like scrolling through Instagram or you're on Facebook or whatever. Mm-hmm. There's ads that pop up constantly. So, I can say, at least if I'm on Facebook, sometimes I don't even know that it's an ad. I have to look at it and be like, oh, that's not just a person in my feed. That's actually a paid for sponsorship. Yeah. Okay.
Yeah.
So like... the way there's so much information out there that we receive on a daily basis on the TV, just it can be overwhelming. Mm-hmm. And I don't want to say often, because I don't think that's the fair word, but it's not uncommon that information isn't 100% factual. Mm-hmm, mm-hmm. And so it's hard. It's like, what do I believe? I don't know.
Yeah.
Or you have somebody who only has one piece of the puzzle, right? And they're saying, well, this was my experience and this is what it is 100% of the time, and that's maybe not true. Maybe that 1% that they experienced, it was true for them, but 99% of the time, that's not how it works,
And I don't shame anybody. I mean, we can't be fact checking everything that we read. I mean, that would be a full-time job. So I don't shame anybody, but it is important, especially with things like that, to be educated about it. But yeah,
For sure.
I definitely want to hear from people out there about your facts or fictions.
Yeah, and hey, if you are too like nervous to even say it on a social media platform, you can always message us.
Yes, yes.
We will work on it for you.
Just send us a direct message. You know, we won't call you out or anything. We'll just be like, yes, true or false.
Promise not to tag you
yeah.
or at you.
Yeah.
So yeah, I just think that today was really important to talk about fentanyl. We've, I don't know, my eyes were opened realizing that we have 36,000 people more a year than when I started doing this presentation only like 5 years ago.
Yeah.
I mean, that's really shocking, very concerning, and I think highlights that we cannot lose sight of opioid prevention.
Yeah. And I think just, again,
opioid use prevention.
Yes.
Sorry.
So that's why I think it's so important that any adult that has a connection with youth, has those conversations about the dangers of what can happen, and that harm reduction is a really big part of that puzzle. So carrying naloxone, I mean, you could save a lot of lives with that, and then until they can get help. So. Yeah, we got to be diligent about what is happening because, again, not only our state, but all the surrounding states, we're mostly a 30 to 40% increase in the past year.
Mm-hmm. I found it really interesting that, so when we do this training, I guess to kind of give a background and paint this picture, they take a picture of the United States, a map of the United States, and they have rankings of state in order of like higher usage rates to lowest usage rates. And I find that what I found very interesting is it's almost like in this belt where you see a lot of manual labor in those states. And I was like, wow. I mean, it makes sense, I guess, because like I think about like the people I know in my life who might have been prescribed opioids. And it's oftentimes people who were part of like that blue collar working, hard labor body stuff, that have been prescribed in their older age, opioids. And it's like, that's something to keep in mind. I thought, I don't know. I just was, it kind of struck a chord with me, I suppose.
Yeah. I mean, yeah, it happens. And too, with instances of, being hard for insurance or getting into a doctor, having to pay for a doctor, I can see where a lot of people then use other ways to get these medications. And then that's what ends up happening is they think that they're buying some Vicodin or Percocet because they hurt their back and they need to work, but then they end up buying something that's laced with fentanyl.
And their friend says, this is my prescription or whatever.
Yeah.
You just can't trust it. You just can't.
Yeah.
It's not worth the risk.
And it's tough. I get it. Like my dad worked, he worked at a bednight plant mining. I don't know how many times he's Iron Man at this point. He's had so many, hip replacements and rotator cuff surgery just from wear and tear, slammed his hand in boxcars numerous times. So I get it, but it's just not worth the risk. It just really isn't.
Mm-mm. Well, Betsy, I think we have come to a point of what feels pretty natural of an end. So for anybody, just, if you're listening to this, know that there are resources out there for you to either learn how to talk to your youth, to learn how medications might affect your body and how you can work with your doctor on that. There's naloxone out there. We have information for tips for parents. If you are ever like, I don't even know what to do or where to start, reach out to us on Facebook Messenger. We do have that live currently. And we'll connect you with some resources. That's what we're here for. We're here to help reduce use, specifically with youth, but also across all of our community members. We're here to help. So let us know what you need, and we will certainly be happy to get it back to you. As a final side note, I suppose, we do have, we've sponsored drop boxes for prescriptions and over-the-counter medications. So if you're sitting at home right now and you've listened to this whole episode and you're like, great, I know some steps of how to like watch out for myself, but what do I do with all this stuff sitting around in my house? I don't need it. Where do I get rid of it safely? Reach out to your local law enforcement agency. Most of the Porter County ones have that. There's also some in, I think, Walgreens, CVS, pharmacies. Reach out to them. A lot of them have drop boxes as well, where you can take over-the-counter or prescription medications. They get put in this box, they get shipped off to the DEA, and they get destroyed.
Mm-hmm. Yep. A lot of times, if you just search medication destroying or drop boxes, they will give you a list in the area and exactly what they take. Some take needles, some don't. Some take chemo drugs, some don't. Some take, various, liquids. So that'll all give you that information. But yeah, most of the pharmacies in the area definitely have drop boxes.
And it's a DEA sponsored program twice a year. So nationally sponsored program. So yes, we're here in Indiana, but at least in April and October, you should see some sites pop up in your community if you don't have any, or surrounding communities if you don't have any local ones right now.
And reach out to your local hospitals and clinics too. I've seen those in quite a bit of those areas too. So I'm sure that anywhere where you are in the country, you'll be able to find a drop box.
And safe storage never hurts. So lock it up until you get it, till you get it dropped off.
Exactly.
All right. Well, with that, we would just like, I guess, to say thank you for listening. And if there are any topics you're interested in hearing about, we work specifically in the prevention world, so we can really dive into prevention of substance use or substances. Betsy and I work on a grant that focuses on alcohol, marijuana, and opioids. So we specifically can cover those topics ourselves, but we also have local experts that we can pull into conversations. If there's anything you want to learn about, let us know. Reach out to us on Hub Coalition, on our Facebook, PC, Hub Coalition PC, and on our Instagram.
Yeah.
And that'd be great.
Awesome. Thanks for listening, guys.